Okay, again, I'm Nancy Allen, Executive Director for the National Consortium for Health Science Education. We're excited that you're here. We will tell you that for those live attendees, we'll be sending you out a certificate of participation for 1 hour of professional development. So if that's of help to you, if you have to document professional development hours for your teaching certificate, we are happy to do that for you. So we'll send that your way. We'll also send you a link to the recording. So if you miss something, you're welcome to go back and get this. And like I said earlier, it'll also be archived on our website. We had the pleasure of meeting Deanna in Charleston, South Carolina in October of 2022. She came to our National Health Science Conference and served as a workshop presenter. And Laura Morris, who is now the past chair of our board, she sat in on Deanna's workshop and she said, oh my goodness, this is good stuff. And so we need to get her to do a webinar. We need to find out how we as a consortium can collaborate with them to help them market what they're doing. And also she'll tell you a little bit about a project that we're doing with them as an organization. And lastly, before I pass her the microphone, that conference will be again this year. It's an annual event every fall, October the 16th through the 19th. We will be in Seattle at the Seattle Westin. So if you haven't already heard about that, we invite you to go to our website. I'll put the link in the chat here. Our whole conference page is built out there. There's a letter to attend, like a template that you could use with your administration when you're trying to seek funding and support to attend our conference. Also, the hotel link is there. There's a call for proposals link that you can submit a proposal and then be a part of the professional development delivery of the conference. So with that, Deanna Ingram, and she'll tell you a little bit about herself. She has some history as an educator, I believe, right? A little bit. And so that gives her a lot of credibility with the people here on the call. So Deanna, thank you so much. And we appreciate all the work you're doing there at the University of Nebraska Medical Center.
Thank you so much, Nancy. And hello, everybody. I'm so grateful to be here and to share uBeats with you all. As Nancy mentioned, kind of a little backstory of how I came into this position, into working with uBeats. I originally started as an elementary educator and I taught 4th grade for about 5 years. I loved it, but I also had, during that time, I had gotten my master's in literacy, and I also had an endorsement in ESL education. And so after 5 years, I decided I wanted a little bit more experience within the ESL endorsement that I had. So I moved on to high school ESL, where then I taught literacy and science. And at first I thought, wow, those are two completely different areas of study, but they actually go really well together. And as educators, we know that there's always room for writing and reading in any content or subject area. So that I stayed there for about 3 years and loved that as well. Gained so much knowledge just in the science field and got to do some really great curriculum writing for those students to be successful, and just a great opportunity. And then this position presented itself, which my official title is the Curriculum and Education Specialist for the uBeats program. And we'll get into what uBeats is here in just a few minutes. But I still get to interact with teachers on a daily basis. I still get to go into schools and support students. And so it's kind of the best of my love for curriculum mapping and organization and project management, and then still that teacher classroom side. So a really cool opportunity I've been given to be here. And through this position, I was sent to the National Consortium for Health Science Education Conference this past one in Charleston. And then, as Nancy mentioned, was able to meet Laura and Nancy there and just form a great relationship. And we've been able to collaborate since then. And I'm so excited to show you where uBeats is headed and how NCHSE has helped us become even more successful in this past year. So without further ado, I'm ready to jump in to our session, and I will pause throughout the presentation just because if you have questions, there's a lot for me to unload and to share with you as far as our background, what we have to offer, and what uBeats is. So I will take time throughout the presentation just to pause and give us a moment if you have any of those questions. So uBeats, what is it? Well, what does it stand for, I guess, is a great place to start. And that is the UNO, which is University of Nebraska at Omaha, and UNMC, which is the University of Nebraska Medical Center, building excellence in academics through STEM. I have quite a few teachers that say, oh, STEM, I don't teach STEM, I'm more health science. We are really both. I know our title says we are STEM, but as you'll see in our presentation, we have so much health science content to offer to teachers, and we've actually seen that portion of our program really just take off with teachers and find success with using it in a health science classroom or pathway. All right. So this isn't your typical PowerPoint. This is what we call Storyline. It's the program that we use to build our modules. And so I just wanted to give you all a little idea of some of the characters, some of the features that you would see in a typical module. So a lot of our modules do have characters or a storyline that's associated with the content we are trying for students to learn. And so here are two of our characters. One is me, Deanna Ingram, and then over there on the right is Zuzi Solkova, and she is my partner in crime with this. She is the person behind the scenes building all of the modules and the content that you see. So her title is uBeats Instructional Technologist, and then I work with her to kind of get those modules going, make sure that our subject matter experts have them approved, and then she creates and makes all this beautiful magic. So just a little glimpse of what our characters and some fun things you might see throughout a module. Our first part here, we're just going to talk a little bit about our history. How did we get started? We're not a very old program. We're pretty new, but what is uBeats? What's that history? Then we're going to take a tour of uBeats. So, okay, I've signed up. I'm in the system. I'm ready to start. What will I see? So we'll take a look at that Canvas because we are housed on the Canvas learning platform. And then finally, we're going to pretend that we are a biology teacher. I know that's more science in, but kind of a pathway of study into where we would see what modules would follow into this pathway and what that looks like diving into those modules as well. A little history, and here again, more graphics to make it as interactive and as engaging as possible when we share these with our students and our teachers. We are a direct collaboration of the High School Alliance that is based out of the University of Nebraska Medical Center. And I want to give you just a quick little glimpse because I love our High School Alliance program, and I don't think there's too many of them in the state. But the High School Alliance program is for juniors and seniors here in the Omaha metro area. And they have to go through a pretty rigorous application process. They have to have interviews, they have to write an essay, they have to fill out an application and explain why they should be accepted into this program. Once they're accepted, then they are able to come to our campus and receive really amazing hands-on skill-based learning. through the health science lens. So some of the students I've interacted with, they want to go into nursing, or some want to go into as far as cardiology or surgery. And they offer all kinds of different experiences there on campus for these students. The only problem is they have to close it off at about 90 students. And typically there's over 200 that apply. So that's where we come in. How can we support these students that still have an interest in health science or the medical field? How can we support them with the content? We can't provide the hands-on learning, but we can provide the content. How do we do that? And that is through digital e-learning materials. So overall, our mission, we really just want to provide early exposure for students into health science or a medical field. A lot of students that I come into contact with, I will say, oh, what area are you interested in? And most of them will always say doctor. But as health science educators, we know that the health science field, the medical field, has so much more to offer than just a practitioner or a physician. So we are here to help introduce, give that exposure, and help to just kind of ignite and initiate a career pathway for these students, and then give them that content, that foundational knowledge that hopefully, again, will ignite and keep them going towards a health science pathway. uBeats officially launched August of 2022. I believe, yes, COVID was happening during that time. And so teachers at that time were so desperate for digital materials anyways. And so uBeats really took off. However, it took off quickly. And so we have found there's a lot of improvements that were needed. And we have been able, with generous donor funding, we've been able to enhance, revise, and show you what uBeats is today. I came on board in June, and since June, we've been able to, I feel like, really just kind of revamp who we are as a program and really connect more with teachers. My position, I'm able to be the liaison between University of Nebraska Medical Center and uBeats. And so I've been able to provide a lot of support for teachers, and that's just been great. That was never a part of uBeats until I was able to come along and take this position. So we just have a lot of different pieces to offer. Again, I'll share more of those as we go. But an exciting piece of this is we started opening up enrollment for uBeats, this revised version of uBeats, in September. And as of today, we are over 13,000 enrollments into the system. And that includes from all over the US. Just this week, I've had some enrollments from Michigan. I've had some from New Jersey and Washington State. And so it's just amazing to see how uBeats is being utilized all over the US. So we're at about 25,000 enrollments total, which is something to celebrate for sure. And we just continue to grow. So now that we know the history, let's look at what we are today. So here are what I call the takeaways. If you're sharing uBeats with another colleague or a friend, these are the key things that you can share with them that I think are the highlights of who we are. So the first one, as mentioned in the description of this webinar and through social media, is we are 100% free of charge. And the reason we are free of charge is because of those generous donors. One of the stipulations with our program is that we would not charge teachers or students to use this. And thankfully, we've been able to keep that commitment. So this is a free interactive set of online modules for grades 6th through 12th grade. We recently, when I came on board, we were about 62 modules in our Canvas course. And with the help of Zuzi that was shown a little earlier, she has been able to get us to a library of about 82 modules in both science and health science content areas. So that's really exciting. That's a lot of development, a lot of work, but it's so exciting to share what we've been able to do there in a few months, and just continue to grow, because every time we talk with educators, there's a new area that we've never thought of, or a content area that they wish there was more of. And so we take that to heart, and that library just continues to expand. Something that's important to mention is we are not wanting by any means to take over your core curriculum. We are what we call the gap filler. So if you have an area that you are teaching with your students and you just think as an educator, man, I would love something a little bit more, I would love a career connection, something just to fill in this gap here, that's where hopefully we can come in and support you. So we are a companion resource to your core curriculum, not to overtake that, but as a companion piece. And something else that's really, really great about our program is every single module that you will find on our Canvas page, every one of them has been vetted by a university expert faculty member. So an example of this is I recently wrote a storyboard for a module that will be coming out about obesity. It's part of a three-part series of wellness. So it'll focus one on obesity, one on physical fitness, and then one on nutrition. And so as I was creating the storyboard, I directly worked with one of our faculty members there on campus to verify and approve all the content that I was putting into the module. And that's just more for our educators to say that, hey, this isn't just Deanna sitting in Omaha thinking of an idea, and it's trying to come to life in a module. This is content that has been verified. It is accurate. It's relevant and has been vetted by one of our experts. So I love that we can say that for every module you come across in our uBeats library. Now, as educators, there's some perks here for you too. The first one is we found that a lot at the end, I should back up. At the end of our modules, you'll see that each module has a summative assessment. The summative assessment is of 10 questions, standard multiple choice. And what was happening was students were having to take a snapshot, a picture of their grade, and then send it to the teacher. And the teachers that we heard from said, can we just have access to the grade book? Because Canvas has a grade book. And so through different things we were able to do, we now can give access to that gradebook for our teachers. So you can keep track of those summative assessments of your students, and then you can use those however you see fit. Collect a few together and do an overall grade. That's up to you, but you do have access to those grades, which is wonderful. Next, it is important to mention that we are COPA compliant. We're compliant with student privacy. What that means is when you register for uBeats, you're going to tell me how many seats or how many logins you would like for your classroom. I then will send you a list of logins and passwords that are number specific, but I do not know who you assign those logins or passwords to. That's part of our funding, part of as it being a free program we can offer. This was also another stipulation of the program that we would not receive any student information. So everything is de-identified, which we have found that districts, teachers all love that, because then you don't have to go down the loophole of legal paperwork and documents. It's a pretty seamless, hey, I would like to use this, and you don't know who is using it. So great, that works perfect. So that is important to mention. Next, yes.
There was a question from Laura. She said they use Google Classroom. Would this be compatible?
Yeah, great question. Absolutely. You do not have to be a Canvas user. I will send you a link to the Canvas website. Then your students yourself plug in your password, username that I send you, and you're good to go. But no, you do, it doesn't matter. Microsoft Team, any of that, whatever platform you use, it will work just fine. Great question. And then curriculum support, I've already kind of talked about this. That's me. I'm here to support you. We know that with the ever-changing environment of education, that sometimes those support roles of instructional coaches or anything like that, facilitators, sometimes they're not able to be there in the building just due to other obligations or teaching. So this, I know it's a small part of probably of your day or your teaching, but just know that you would have curriculum support. So I recently had a teacher here in Nebraska that loves uBeats, but was struggling with, I don't know what module to plug in where. And I said, why don't you send me your pacing guides for the year? Let me take a look and I'll tell you what modules I think go where. And so I did some curriculum mapping for her, and now she's ready to go come August. And so that's just another advantage to uBeats, that we're able to provide that support for educators. And then currently we are aligned with Nebraska state science standards, but also the next generation science standards. And again, I know a lot of you are health science, so I will go on to the next exciting news to come. So coming soon, as Nancy mentioned, through our collaboration together, we are in the process of aligning and verifying uBeats curriculum to the National Health Science Standards. This was made very loud and clear from educators that this needed to happen. And it just so happened that in going to Charleston, we were able to connect Nancy and Laura and I and get this started and moving. And so we're in the process right now of verifying, again, all of those pieces, all of those modules, and it should be completed by May, which means come August, when school starts up, you would have all of these modules aligned to the National Health Science Standards, which we are so excited about and can't wait to offer that for and to you. Okay, I think that's a good stopping point, because we're going to move into the next realm, which is looking at going into Canvas. So Nancy, are there any other questions, or does anyone have any questions about uBeats so far?
I have a question, and that is, could you tell the group like what that crosswalk will look like where would they find it if they wanted to use modules to reinforce the National Health Science Standards that they may be teaching in their classroom? Where would they be able to find that end product of the project?
Yeah, Nancy, great question. So we will actually have a matrix, and what that matrix will do will show you the module, the topic area within that module, and then the objectives, and then the standard will be right next to it that's directly aligned. And that will be found on our Canvas page, and we have a section on our Canvas homepage titled Teacher Resources. I'll show you that here in just a minute. And in that teacher resources, you'll be able to access, print off, download that matrix, so you have it for all of our modules and all of those standards. Great question. Were there any other questions?
I didn't see any. I saw someone thanking Laura for asking a question about Google, because they use Google Classroom too. So
great. Okay, well, wonderful. We'll keep moving then. So here we're at the point now where you've registered for uBeats you have your login and password, and you're logging into Canvas, and this is what you see. This is our home page. So I just like to show you this, kind of walk through it just so you know what to expect. Up here at the top are what I like to call our big umbrella topics. So those topics that uBeats covers would be areas of genetics, pharmacology, pathology, and microbiology. We do have a section in careers, cancer, public health, and then our two newest ones would be academic success and teacher resources. So as I just mentioned, that matrix where you can say, okay, I'm using this module in genetics, what's the standard? That matrix will be housed here in the teacher resources tab. And you can print it off, you can download it, or you can just have it here on Canvas. It's there for you to access. But academic success, we actually just recently added these. There's about 7 modules in here, and this is areas of like growth mindset for students and how to master exams. And so it's a little outside of the heavy science, health science content that we offer, but we're finding that these are getting used so much. And a lot of times it's because teachers are saying, hey, at the end of the week, I'd like my students to do an academic success module, and then we have discussion groups around it. And how does that apply to the health field or the medical field? And so it's really interesting how that's getting used, and very exciting as well. So you'd have those big umbrella topics, and then we went through, and within those big topics, we have kind of condensed them into smaller subtopics. And this is more just to help you, okay, I have this idea in mind. Is this genetics? Is this pathology, microbiology? So just a little bit more to help you gear where you're supposed to go. And then you can see those subtopics here. So under genetics, we'd have cell biology, genetics and biotechnology, and so forth. Over on the side, you're going to see any announcements. So if we're ever doing an update or anything like that for uBeats, we will post it there in Canvas. And then teachers, you will have access to those grades. So students are not allowed to view those. We have not given permissions for that, but teachers, here is where you would come to that grades tab to open and see your students' work and scores. So if we picked careers, we click on the careers tab. Here is what you'd find. You would find our list of modules and topics we offer within careers. So here you can see we have careers in pharmacy, public health, dentistry, medical imaging. And then what's a great tool to have alongside of that is each one of our modules is paired up with a teacher guide. And so this teacher guide gives you all the vocabulary that's going to be in the module that might be of high importance, maybe to review beforehand, or you might want to do an activity within it. It also gives you a section of previous knowledge, probably areas you should have mentioned or you might want to mention before diving into a module like this. But students do have access to this, but we have found there's nothing, if they got their hands on them, there's nothing that would be wrong with that. If anything, it would probably help them. But that is there for you. So in one fell swoop, you can download, print off your teacher guide, and it's right next to the module that you would be using. All right, so we're moving into our next section, and this deep dive here is what I have mentioned of us pretending we're going to go the biology, the science route here. But if we were teaching biology, a cellular biology unit, and you were to sit down and start planning, you would say, okay, what modules fall within this area of study? And so we have found in typical units, we can find anywhere from 2 to 4 modules that align really well with what teachers would be going over. So, oops, I'm sorry. I don't know why I did that. So now let's go in and see what this looks like, what a module looks like. So I do want to note before we keep going that all of our modules do have accessibility tools. We do offer closed captioning, as you can see here. And then up at the top, we do offer a transcript that teachers have access to, students have access to, that they can print out. Also, all of our modules are also narrated. So students can plug in, listen to that as they go. Our feedback at the end of summative questions, all of that is narrated as well. So here we are, we're in the cells and nucleus introduction, and we do our best to try and add as many interactive pieces into the module as possible. We all know that as educators, you've got to keep them engaged or they're checked out. So we have to do that through some kind of gamification or some kind of action item. So here would be one of those within a module. And this is building a plant cell. So here, an example, add an organelle that would be needed to control the plant cell's activities. We look over here at our vocabulary. So again, that would be in your teacher guide. Hey, you might want to go through these words before you start this module, just for students to be successful. And then it's drag and drop, and students can complete that. So we do have those as sometimes 3 or 4 within a module. At least once is our goal to have that engagement piece there. Okay, so let's say you've done cellular structure and function. We're going to go a little bit more into this now, and we're going to look at mitosis and meiosis. So here we are again within a module. This is another interactive activity that students can do independently on their own in the module. And this is just a simple slide check to see if I'm right. Okay, perfect. Then we would keep going and it would move you through the stages. So now we're going to keep, as you can see, the content, we started with kind of a foundation, basic knowledge there, parts of the cell, and now we're moving into more of the advanced, what I would think, advanced content areas. So we know that that foundation there is parts of the cell, and then what happens with those cells, what goes on. And here we are at one of our cancer modules. To note here, we do really try to include as much vocabulary embedded within the module as possible, just because we know sometimes you go over vocabulary words and students forget or they need a reminder. So we do our best to try and add parts within the module where students can access a vocabulary word like this and have that definition right there. And then finally, our goal, as mentioned earlier, we really want to set students up for a pathway into health science, medical field of study somewhere. And so we've tried to think through different areas, and we don't have all the career connections yet that we would love to. They're in the process. They just need to be developed, but we do like to end with a career connection. If I find parts of the cell and biology really fascinating, what can I do with that? Can I be a doctor? Can I do something else? And so an example here, careers in medical imaging and therapeutic sciences. This might be an area that students say, I had no idea that this even existed, or I didn't know that my love of biology could translate to this career. And so this is where we see a lot of our educators, our health science educators, especially really relying on these career modules to fill in some of those gaps when it comes to content and then building that bridge for both. So that's a pretty good stopping point as well. That's a lot to digest as far as content and how that looks. Are there any questions or anything we can talk through?
I have questions, and then there may be more. There's one from attendee who says, I currently have a teacher login. Will I have to reapply for that login for the next school year?
So that I'm so glad that came up. uBeats used to be a carryover program where once you got your login, you were in there for life. However, as of this year, we are switching to annual enrollment, and there's multiple reasons for that. So I am in the process right now of sending out communication to our current teachers and letting them know that if we hear back from you, we can re-enroll you come the first of the school year. And then we've also had some teachers say, I would like to use this for summer school. That's not a problem either. We're more than willing to accommodate that, but we will be closing what we call closing our enrollments and our current used passwords and logins May 31st. So if you're already in the uBeats system, that's fine. We'll get you set up here at the end. I'll have a QR code for you, and let's get you set up so we can get you re-enrolled come August. Or if you need summer school, we can do that too. So yes, we are switching from carryover enrollment to annual enrollment. So thank you for bringing that up. That's great.
Okay, next question. What grade level are these most appropriate for, or are they identified on the module? Which grade level? Can you speak to that?
Yeah, that's great. We, as a team, we have removed from the actual modules, we have removed the grades, and I'll give you a little background as to why. We have several senior high school teachers that were needing to kind of bring a student along and give them a little review. And that, for an example, that cell one that we saw, the cellular structure and function, that is definitely geared more for a sixth grader. However, this teacher wanted to use it with some of her seniors. And so we did remove that from the module. So it doesn't say sixth grade module. It's for all, it's accessible to all. Now, with that matrix that I mentioned, that would be on that uBeats Canvas page. There you would see the grade level. So if you said, okay, I'm looking at this one, I have my matrix, or even the teacher guide will say this is appropriate 6th through 8th grade, or 6th through 12th grade, or 6th grade. The teacher guides or the matrix will give you those grade levels, but we did want to remove them just to make them equitable and accessible for all of our students, regardless of grade. But they are there if you need them.
Okay, next question. I think you're going to get to this with some QR codes at the end, but I'll just put it out there. This is from Anita. When can we register for uBeats, and how do we do so?
Yeah, that's great. And we are actually, I think that's a good segue, Nancy. So we're here. I have 3 QR codes, and I want to walk you through them just so you know what each one is. So this first one over here, try a uBeats module. We have about 6 modules that are open for you to access and go in and try one yourself. I personally cannot recommend this enough, because I think as a teacher, you getting in there and seeing how it works, each module takes about 15, 20 minutes max. And so you getting in there and seeing how this works is probably going to be the best decision if this is going to fit for your curriculum or not. So you have that QR code right there that you can scan. The one in the middle, the green one, it says sign up for uBeats today. So if you say, oh, wow, I think we're in April. March feels like it's already done to me, but maybe you say, hey, these last few months of school, I would love to use those career modules, or I would love to maybe pick one and make my own little pathway for students. Let's get you signed up today. So you can use that QR code as well and sign up today. And if you say, oh, I really like uBeats, this is great, I think I can use it, But I would like to wait till next year. Let me see what I'm going to be teaching, how many students I'm going to have. Then this is the QR code I would recommend you go to. And there will be a Microsoft form there where you can tell me what your plans are. Hey, I would like to enroll. I just need to wait and see how many students that I'm going to have, or whatever your plans are. That's a good option for you. But all are available. And I was going to say the registration, I do all of our enrollments. And so I think on our website, we have 1 to 2 business days, sometimes with high volume, like after the NCHSE conference. It took me several days to get through how many enrollments we had. So I will be in charge of those, and I will try to get them. If you sign up today, I will try to get them to you as quickly as possible. But you can expect 1 to 2 business days. Yeah. Anything else, Nancy? I'm going to leave this up just so teachers have a minute here to go through these QR codes.
And there's a question from Mary, and she said that she received an email with a spreadsheet of login information today, but she's having trouble logging in with the information she was given.
Yes, so unfortunately, right before I came on, our Canvas, who would be our Canvas go-to person, said that it's not the student logins. Your student logins would be fine. The teacher logins are not registering with Canvas. This rarely happens, but we know it's technology, right? It's just what it is. However, they are working on it, and it should be fixed probably by the end of today, if not in the morning. So hold tight. I'm sorry, it just fell that way. It's like anytime you go to use technology and you need it the most, it doesn't work. But your student ones will work. It would just be your teacher one that might give you some trouble. So I'm sorry about that.
Well, I'm glad you were here to help Mary through that question. And there's another one from Anita that says, will we be assigned a login? And that would be if they go to one of these QR codes, right?
Right. And so if you go to the green one and you sign up today, you would receive however many student logins you request. And remember, there is no limit. So if you have 150 students, then you request 150 students. And then you'll also in that sheet that you receive, you'll also receive a teacher login and password at the bottom that then you can go in, you can access uBeats, see those grades and all those other things mentioned.
Okay, I'm moving on down with the questions, okay?
Perfect.
This is from Jenna, and she wanted, will there be some sports medicine lessons in the future? I don't know, did you have any health careers around athletic training or exercise science? I can't remember if you did.
That has been, that and medical terminology are the two I hear all the time. And I wish I had this magic boom, here you go, because I know teachers need that so bad. We're hoping that in that wellness series, the subject matter expert or the vetted expert that we're using for those is also certified in sports medicine. And so we're hopeful that that is coming down the line. I can't make any promises, but I have heard teachers loud and clear, especially there at the conference, mention that's an area they would love to have module development in. So I hear you, but it's a work in progress. So definitely in our doc of what we hope to develop here soon.
Well, certainly some of those broad foundational standards are transferable to many health professions, of which you have foundational content. So don't beat yourself up too bad about that, okay? Here's another question about, are these modules available in Spanish or any other languages? They have some students that struggle some because of the language barriers and didn't know if you had any translations of the worksheets or activities.
Yeah, oh, that's a great one. And coming from an ESL classroom, I again wish that were the case. Unfortunately, we have not really had that request surprisingly yet. But I definitely think that's one to be noted as well. So in my doc of things to improve on when we move on to the next phase of uBeats, I would love to see that happen. But unfortunately, right now we do not have any other translations.
Well, it sounds like these last two questions will definitely give you some job security, right? You don't have everything complete yet. So just
Right.
keep-
The list is never ending, but that's great, right? We want to
Yeah.
improve it, make it the best it can be for sure.
And then Melissa was giving you a compliment on the interactive pieces. Laura asked about how to log in, but Laura, I hope you're clear now because we've maybe touched on that a couple of times. Melissa said she's starting after spring break an 8-week career unit. And so she's looking forward to using some of this content.
Great.
And then Laura also asked about links in an email so I can get into what is offered on my desktop rather than on my phone. So, I mean, I don't mind sending out, are the links underneath there, underneath the QR code? Are those the links?
They are so we have our QR code, and then those would be our shortened URLs. So if you want to type in one of those or jot it down real quick, it will work the same exact way. I also can
Amanda
send
put
out
them
no,
too.
go ahead.
Amanda put them in the chat for us.
Perfect. That would be great.
Okay. All right, that's all the questions. Somebody's giving you a thumbs up, yay, on medical terminology. So I don't know if you have some more content to go through, but that's all the questions I see right now.
Okay. Well, I just have a couple things to close up. This has been great. I love your questions, and of course, feedback. I love hearing feedback because, as mentioned, I just came on in June, and I am still, I was still learning uBeats and what it has to offer, and I see so many areas that it can even be improved more. And so it's exciting. It's exciting to hear what we can take from teachers and the feedback that you offer us and how we can make it even stronger, even better. Just a couple quick things to mention. We do have 2 social media accounts. And on both of those on Mondays, we do a post called Module Monday. And that's where we take one of our modules and we highlight it and we give you some tools on how to use it. We give you a link to view it, all different kinds of things for you to engage with us on. And that's on Mondays. And then on Thursdays, we do a Spotlight Thursday. And that's usually one of our collaborators. That could be one of our team members. That could be one of our experts. And we've found that actually has really been a really cool tool because an example is a couple months ago, we highlighted one of our climate, water, and health experts, Dr. Bell. And there were several teachers environment or ecology teachers that had come across our social media and said, oh, I would love to connect with him, have him talk to students. And so it's kind of turning into this really cool platform just for connecting and getting you in touch with some other experts in the field of health science, and medicine. So I encourage you to follow us if you can, Twitter, Instagram. It's also another way we run those. Susie runs Instagram, I run Twitter. And so if you ever have a question that you're like, I don't know about email, I would actually like to ask this right now, I would be willing to guess we probably would respond on social media due to our notifications and things a little bit quicker than email. But it's just another outlet for you to connect with us and be a part of the journey. If we're in your area, if we're any of those things, we announce all the things that uBeats is doing. So make sure you follow us on there. And then recently, Susie and I were asked to be on the Good Life ESU podcast, and it streams on Apple Podcast and Spotify, and it breaks down uBeats just a little bit more. So if you just really love uBeats and you want to hear all the things in my voice again for 30 minutes, then you can log on and listen to that podcast. But gives a little bit more just to what we're doing and who we are in the state of Nebraska and the great things that are happening too. So make sure to listen to that. Otherwise, there is my email. Susie's, if you have any questions about how the module is working or Canvas, she's a great person to connect with and to email. And then I'm here for support. I'm here for any questions with enrollment or uBeats questions. I can always ask her as well too. Yeah, I think that's it for me. Are there any other questions that we had or wanted to go over?
Anybody need to unmute yourself and ask her one last question before we let her go? Mary?
I just want to say thank you that we have high school things like this now, because during COVID, I did use a few of the modules that are there for PPE and things from Nebraska Medical Center. So I'm glad there's a whole new platform for the students to use, because I thought my students enjoyed using those. So I'm looking forward to this, and careers too for me, because that's what we're doing after the break.
I love it. Great. Thank you so much for that.
Thank
feedback.
you.
We love to hear it. Yes, thank you.
I don't have any questions, but I'm excited to get access and start playing with it and seeing how I can use it to help my students.
Wonderful. Yes. And like I said, we're here. So if you run into questions, you run into hiccups, it was because of a teacher that recently signed up that I realized the teacher logins were having an issue. So we rely heavily on our teachers for feedback and letting us know what's going on out there on the field. So please, by all means, let us know how it's going, improvements. We're open to that constructive feedback all the time.
Well, Deanna, thank you so much. I mean, I think the word free might be our favorite word, right? But just, I mean, we cannot tell you how proud we are of your institution and all that you're doing, and that you really see the value of connecting with young people at an early age. And so thank you for this resource. Our favorite word, Laura said, free is our favorite word. And we'll look forward to seeing you in Seattle and hearing about when the project is complete, when the modules are all aligned to the National Health Science Standards. That will be such a value to teachers who use those, to make sure that they're covering what industry believes students need to know and be able to do when they complete a health science education program. So thank you, everyone. The recording will stop, and we will have this on our website.